Hello, hello. I am doing my project on juvenile idiopathic arthritis. Juvenile idiopathic arthritis, it is a type of arthritis that only happens in kids and teens. It's an autoimmune disorder, so they don't really know what causes the condition. Researchers think that kids with certain genes, those genes get activated by a virus or a bacteria or something like that. So, and it gets activated and causes an immune response to attack the joints and causes inflammation and pain in the joints, which are your elbows, your knees, your ankles, your wrists, your elbows, your hands. So the symptoms are joint pain and stiffness. It gets worse after waking or staying in one position too long. So that can be problematic. You got children staying in school 8 hours a day. School age children get to have PE and recess, but those kids who have 7 different classes in a day or, whatever, they only get to get up and walk changing classes. So you sit in a desk all day long, them joints get really stiff and they get to hurting really bad. They can get red, swollen, tender, warm. These children are very fatigued. They have blurry vision, dry, gritty eyes, rash, appetite loss, and high fever. So juvenile idiopathic arthritis, or JIA. There's 7 different types. They are put into these categories because just because you have JIA doesn't mean every single child that has it have the exact same symptoms. Some of them have one joint affected. Some of them have 5, 6, 7 joints affected. So that's how they're put into different categories, determining how many joints are involved and what their symptoms are, along with the joint pain. So here's my disclaimer. I'm sorry about my pronunciations about some of these because it's just awful. But there's systemic oligoarthritis, polyarticular arthritis, and those can be rheumatoid factor negative or rheumatoid factor positive. You got psoriatic arthritis, enthesitis-related arthritis, and undifferentiated arthritis. Systemic JIA, that's exactly what it sounds like. It affects your body systemically. So it affects the entire body. You can have a high fever that increases and then drops to normal suddenly. The child is very ill during the fever, and I imagine, if you have a fever and you're sick, you feel awful. So you have a fever that gets really high and then it drops suddenly. The child is probably going to be very, very sickly. The lymph nodes and spleen may be enlarged. Rash, joints are swollen, painful, and stiff. Oligoarthritis. This can affect 4 or fewer joints. The knee and ankle are mostly affected. You have pain and stiffness, swelling in those joints. It can either be persistent or extended, which is determined by how many joints are ultimately involved. Polyarticular arthritis. There's 2 different types. You got your rheumatoid negative, so you have no rheumatoid factor in the blood. This is swelling or pain in 5 or more joints. The small joints and weight-bearing joints are affected. Low-grade fever may be present. Nodules may be in areas from pressure of sitting and leaning. So like I said earlier, those kids, sitting at the desk all day, they lean to one side. Um, that's really painful. Especially considering kids sitting at a desk all day long. Polyarticular arthritis, rheumatoid factor positive in their blood. This is most like adult rheumatoid arthritis. They are at higher risk for joint damage than in other forms of JIA. Psoriatic arthritis is the children who have the typical joint symptoms and also have a psoriasis rash. It's those scaly, plaques that can start behind the ears, eyelids, elbows, knees, or scalp. Enthesitis-related arthritis, it affects the legs and spine. It includes a special group called ankylosing spondylitis and the arthritis that's associated with inflammatory bowel disease, which ankylosing spondylitis and inflammatory bowel disease, which is your Crohn's disease and ulcerative colitis, those are also autoimmune conditions, so they are somehow related. Affects the legs and spine. You may have swelling at the entheses where the tendons join the bones. So that's a lot going on. Undifferentiated arthritis. This doesn't fit into any other categories. So you could have, it might sound like the oligoarthritis, but you may have more symptoms going on with it. So they can't really say you got it. So they just put you under undifferentiated. Or it fits into multiple categories. So you have the symptoms of the oligo, the polyarticular, and the psoriasis, and they don't want to put you under all three of those categories, so they just put you under undifferentiated. JIA can occur in one joint or many. So if it's only in one joint, I'm sure it's much more manageable and attainable than if you have it in both your knees, both your elbows, one hand, and one wrist. In high school, I had tendonitis in my right elbow, and it really, really, really hurt. I mean, I couldn't imagine having chronic pain in multiple of my joints, and being stiff makes it worse. Sitting down watching a movie on, after a long week, you sit there and binge watch a few shows or a few movies, and you try to get up and you're in excruciating pain because just not being mobile makes those joints stiffen up really bad. They get swollen and start hurting. The main subtypes of JIA are oligoarticular and polyarticular. Some forms happen more often in girls. Usually the more joints affected, the more severe the disease is, and less likely the symptoms will go into total remission. So JIA can be exacerbated, or you can be in total remission. And remission means you don't have any of the symptoms. So you don't have no joint pain, you don't have no swelling, no redness, no fever, no rash, none of it. It acts like it's not even there. Exacerbation is when the joints are red and swollen and painful. You have the fever, you got maybe some of the systemic effects going on. You go into remission by taking medication basically, or having surgery. And that's how JIA is managed, is by medications. Happens in children between 6 months and 16 years old. I think the average age, I think I read in one of the papers that I was doing this project on that you usually get diagnosed by 13 years old. It'd be hard to diagnose, like a 2-year-old, because yeah, you could see how the joints in the child would be swollen and red, but they're not going to tell you, how bad they're hurting in certain joints. They're not going to be able to, explain that to you. But a 10-year-old can always complain to you like, Mom, my elbows hurt so bad. My knees hurt too. Seems like the longer, every time I after school, my knees are really, really hurting. And a child 10 years old can explain that to you versus a 2-year-old. So it's probably easier to diagnose the older they get. Diagnoses, you got your CBC, blood cultures, a biopsy to rule out other conditions, erythrocyte sedimentation rates, you got C-reactive protein, you test for the rheumatoid factor, anti-nuclear antibodies, that's a blood test to detect autoimmune disease. You got x-rays and MRIs. Treatment, NSAIDs are used to relieve pain and inflammation. So you got your not Tylenol, but your Motrin, your ibuprofen, your Aleve. Corticosteroids are prescribed for flare-ups, to get that swelling down quick and in a hurry. With corticosteroids, you don't want to miss a dose. You want to take them like you're supposed to, and then you get tapered down. You really don't want to miss a dose of prednisone. You got DMARDs, which are disease-modifying anti-rheumatoid drugs, methotrexate, and there's many others. You can use DMARDs with NSAIDs, or you can take them when NSAIDs fail to relieve the joint pain. Biologics, adalimumab, that's Humira. Biologics help reduce systemic inflammation and prevent joint damage. You got physical and occupational therapy. You can work with these professionals to have certain exercises, or you may get a special device from occupational therapy to help you like tie your shoes, get out of bed, stuff like that, so you don't possibly exacerbate those symptoms. Usually, the treatment is just medication. In very severe cases, a child will have surgery. Usually it's not needed though, because with all these medications, you usually can go into remission. So that's a good thing. And there's a ton of different DMARDs and biologics to help these children go into remission. So if one doesn't work, there's many others a child can try, and whatever works for their body, they can take it. And it's not just a one-time deal. They have to take these medications for the rest of their life, because this is a chronic condition and there's no cure for it. Lifestyle, you can get regular exercise that promotes bone strength and joint flexibility. So get them kids playing sports, play outside with their friends. It's really good for them to stay moving and not get immobilized for a while, and make it more likely for those symptoms to flare up. You can apply cold and heat. You can eat a healthy diet. It can maintain your appropriate body weight. Adequate intake of calcium, because children with JIA are at increased risk of osteoporosis. Um, the the prognosis for these children is good. While it is, a lifelong disorder, some kids go into remission and they never have another flare up again, but sometimes, some other kids can't get that lucky, so they gotta do some trial and error with some medications. If it gets so bad and they just can't find any medication to work for them, surgery is needed. But generally, you can live a long, healthy life with JIA. Just try to take care of yourself, like always. Take your medications. Try not to get stiff. Get up and moving instead of having to, sit on the couch and watch TV all day. It can make you hurt worse. So getting exercise is good. Eating well is good for all of that. So these children can still play sports and stuff. That's not a limiting factor. Just because you have joint issues doesn't mean you can't be a kid. You can still play sports, play with your friends. You just got something else going on that other kids might not understand. But a kid can still be a kid with this disorder. And that is the end. Thank you very much.